Hi guys, my name is Roxana, as you already know, and my presentation is about herpes. I will be explaining the pathology, signs and symptoms, diagnosis, treatment, and prognosis. So the herpes simplex virus is a sexually transmitted infection. You can contract a sexually transmitted disease by having unprotected vaginal, anal, or oral sex with someone who has the disease. This can appear around the body, most commonly on the genitals or mouth. There are two types of the herpes simplex virus. Type 1 primarily causes oral herpes and is generally responsible for cold sores and fever blisters around the mouth and on the face. Type 2 primarily causes genital herpes and is generally responsible for genital herpes outbreaks. This is a contagious virus that can be transmitted from person to person through direct contact. Children will often contract type 1 from early contact with an infected adult. Then they carry the virus with them for the rest of their lives. Type 1 can be contracted from general interactions, such as eating from the same utensils, sharing lip balm, and kissing. The virus spreads more quickly when an infected person is experiencing an outbreak. An estimated 67% of people ages 49 or younger are seropositive for type 1, though they may never experience an outbreak. It's also possible to get genital herpes from type 1 if someone who performed oral sex had cold sores during that time. Type 2 is contracted through forms of sexual contact with a person who has type 2. An estimated 20% of sexually active adults in the United States are infected with this type. Type 2 infections are spread through contact with a herpes sore. In contrast, most people get type 1 from an infected person who is asymptomatic or doesn't have sores. Symptoms of type 1 include painful blisters or open sores called ulcers in and around the mouth. Infected persons will often experience a tingling, itching, or burning sensation around their mouth. Before the appearance of sores, after initial infection, the blisters or ulcers can periodically recur. Symptoms of type 2 are characterized by one or more genital or anal blisters or open sores called ulcers. In addition to genital ulcers, symptoms of new genital herpes infection often include fever, body aches, and swollen lymph nodes. This type of virus is diagnosed with physical exam, HSV testing, and blood tests. Your doctor may check your body for sores and ask you about some of your symptoms. The doctor may also request an HSV testing. This is known as a herpes culture. It will confirm the diagnosis if you have sores on your genitals. During this test, your doctor will take a swab sample of fluid from the sore and then send it to a lab for testing. Blood tests for antibodies to type 1 and type 2 can also help diagnose these infections. This is especially helpful when there are no sores present. This picture on the left shows type 1 that is in the mouth, and then on the right type 2 is on the genitals. There is currently no cure for this virus. Treatment focuses on getting rid of sores and limiting outbreaks. Medication include acyclovir, famciclovir, and valacyclovir. These medications can help people infected with the virus reduce the risk of transmitting it to others. They can also help to lower the intensity and frequency of outbreaks and may come in oral form or may be applied as a cream. For severe outbreaks, this medication may also be administered by injection. People who become infected with herpes simplex virus will have it for the rest of their lives. Even if it doesn't show symptoms, the virus will continue to live in an infected person's nerve cells. And very important, this virus can also lead to encephalitis when type 1 travels to the brain rather than moving through the body to the surface of the skin. In conclusion, herpes simplex virus is one of the most common STIs that can be contracted by having unprotected vaginal, anal, or oral sex with someone
who has the disease and can cause two different types which are closely linked to each other. Type 1 causing oral sores and type 2 causing genital sores. When someone gets infected by this virus, there is no cure and it can be treated by certain medication but just to get rid of a source and the symptoms. Herpes simplex virus will always stay inside of the host and reactivate.